We're going to do a face up neuropathy treatment. So we did the face down, opening up the sacral foramen, down through the piriformis, down the leg, through kidney 1 to the posterior Bashi points, and did Ashura along the way. So now we're going into the Bashi. These are Bafeng points. These are Bashi points. I can do both. If you want to increase blood flow directly to the feet, the sacral foramen is very important for opening up blood flow and getting things away from the nerve, getting any kind of debris away from the nerve root. Then you can locally, so you go straight in, probably be able to see that foot better. Let's just get this one in. Straight in through the little postural muscles between the toes. And this actually feels very good. We're going to do our hands too. Then you can go into liver 3. And then we're going to come over to the spleen channel and do spleen 3 all the way through. You can also do spleen 4. Spleen 4 is also good for any type of stomach ailment. So if they're having post-chemotherapy stomach problems as well, it's really good for nausea. Spleen 5 is a worry point. A lot of times patients who are coming out of chemo or having some sort of health crisis have stress. I mean, of course. And then kidney 9 is a she cleft point of the kidney channel, and I always use that. It is so good for grounding a patient. It's amazing for nourishing Jing, the lower dantian, and also it clears anxiety very quickly. Master tongs or just a normal everyday stomach 40 for phlegm. As you guys all know, and I know that my Chinese is terrible, so save your comments. These can be fire points. I went down on this side so you could see better, but you can go straight in to do Bashi points. These are actually more doing the second, which is the fire element. The Fang is like in between the toes. Bashi. The big toe is also on top, is also very good to calm the brain. Patients will tend to be reactive to this point. If there's a lot of anxiety or ADD or something else going on with the brain. So you can do all these points or a mix of them. It's not necessary, but these are just options you have. Like if a patient's really sore from you doing here and they're coming in for an intensive, meaning they're coming in every day, you can change up where you're hitting on the foot so that you're not constantly annoying the same spot. So again, you can do all the toes, and then you can do on the side of the feet as well if they're having numbness on the side. So this seems invasive, but once they go in, they feel really good. And if your patient has very pronounced neuropathy, it's a relief and it's really not painful.